Ms. Joan Pereira, next question.
Question 10.
Mr. Speaker, may I take questions 10 through to 13 together, please?
Yes, please.
Sir, the Health Sciences Authority, HSA, and the Expert Committee on COVID-19 Vaccination will only approve COVID-19 vaccines that have met our high safety, quality, and efficacy standards for use here in Singapore. The effectiveness of the Pfizer-BioNTech and Moderna vaccines, which are currently the only COVID-19 vaccines allowed for use in Singapore, are widely recognized internationally. The Ministry of Health will be releasing further information on how individuals can show their valid vaccination status when ready. We will make it easy and convenient to prove one's vaccination status, including for persons without smartphones. The measures required for the unvaccinated are generally based on public health considerations to prevent infection, and so would not distinguish between those who choose not to be vaccinated and those who were not medically eligible. Other vaccines may be available in the future for those who are not currently medically eligible, and we will continue to evaluate scientific data and review the eligibility criteria accordingly. Data on the duration of the vaccine's protection and its effectiveness in preventing transmission has been encouraging thus far. More data is needed to assess if changes to border measures such as testing and stay-at-home notices requirements can be made for vaccinated individuals. More information is also needed to assess if such measures will be affected by the different types of vaccines. We are actively discussing with international counterparts on the possible mutual recognition of vaccine certificates. However, most countries have only just started vaccinations. Border measures will also take into account other factors, such as the number of COVID-19 cases and the infection control measures implemented in the source countries. Hence, progress on cross-border recognition of vaccine certification may take some time. We will provide further updates when there is significant progress. The COVID-19 vaccination program remains voluntary, and MOH encourages everyone who's medically eligible to get vaccinated.
Ms. Fumiha.
Thank you, Speaker. I would like to ask SMS one supplementary question. SMS, the federal authorities in the US have updated travel guidelines for fully vaccinated people. The US Centers for Disease Control and Prevention have declared that vaccinated travelers do not need a COVID test unless required by the destination country and will not need to be quarantined upon returning to the US, but should only be tested before boarding their return flight. So I would like to ask SMS if our Health Science Authority has reviewed the scientific basis for US CDC's recommendations and whether Singapore may issue similar guidelines.
Mr. Speaker, I thank the member for the question. Indeed, it is so, and that is why in the previous announcements there were accommodations made for individuals who've completed the full vaccination regimen, such as from the 24th of April, if you've had more than 2 weeks after your second dose, one can gain entry into events that require pre-event testing without the need to undergo pre-event testing. Similarly, the same set of information has allowed us to make changes to the rostered routine testing for some personnel. So the short answer to the member's question is yes.
Associate Professor James Lim.
Thanks to the SMS for his responses. I'm just wondering very quickly, does the vaccine passport recognition influence our decision to approve specific types of vaccines? So the concern, of course, is that if we are approving vaccines with much lower efficacy rates, that will affect the overall recognition of our vaccine passports when they were to be issued. And related to that, would the acceleration of vaccine passports recognition be possible for countries that are deploying comparable vaccines to us?
Mr. Speaker, I thank the member for his question. The answer is no. The factors taken into account for approving a vaccine are the vaccine's quality, its safety, and its efficacy.
Sang Wei Nang. Ms. Sang Ling Ling.
Thank you, SMS, for sharing about the progress of discussing the vaccine-19 passports with various countries. Well, we need to wait for this to develop because the vaccination programs are still happening in many countries. Can I check how many countries are we actively in discussion with? And are they mostly unique system of bilateral recognition? And are we expecting a significant public budget to have to be invested when countries open up more for such a recognition system to happen for air travel?
Mr. Speaker, I thank the member for the question. It would be premature to discuss the details of this at this point in time. As I explained in my initial answer, the process is very early. Many countries haven't really gotten significant proportion of their population vaccinated. And in truth, we are only getting going and recently. So it's something that we will update as and when we have further information in the future.